Hi, and good afternoon, everyone. Welcome back to those who were attending this morning's sessions. Delighted to be reconvening for what I think is a really important topic, something which comes up daily in our conversations here at Smart in the Field charity around frontline worker wellbeing. And I know that is front and center of everyone's minds around the state of play in the charity sector and wider society after the pandemic, around well-being, and especially the connection between well-being and work. We've got a fantastic panel to discuss insights and resources, and hopefully highlight some examples of good, better, best practice and practical ways to support frontline staff well-being. I'm going to ask the panel members to briefly introduce themselves. I'll then share some detail and context from our frontline worker survey, which again, will be coming out imminently. And then we'll go into the question and answer. And please, those people who are listening in, do add in your questions in the chat. And I won't just be asking my own questions for my own interests from a pre-prepared list, but I'd love to hear from you. And that's the really important thing, is about the feedback loop and the dialogue from participants today for the panel to answer. So if I can ask Kellie, are you able to go first and introduce yourself, please?
My name is Kellie Armstrong. I'm a member of the Legislative Assembly with the Northern Ireland Assembly. I'm a politician, apologies, but my interest and the reason why I'm here today is because I am the Alliance Party for Northern Ireland spokesperson on housing and homelessness.
Thank you, Kellie. Welcome. Pam?
My name is Pam Orchard. I'm the Chief Executive at the Connection at St Martin's. I'm erstwhile Providence Row in London, and also Edinburgh Cyrenians back in the day. I've been working in homelessness for 21 years now.
Now with another Scottish connection, Amy.
Good afternoon, everybody. Thank you for having me along. I'm Amy Hutton. I'm Director of Services with Cyrenians up here in Edinburgh. And I did work with Pam many, many years ago. In fact, she gave me my first job at Cyrenians back in 2006. I have been here that long. I worked for about 5 years in another homelessness charity. So I think I might trump you by a couple of years. I think 23 years in homelessness now. And delighted to be asked along today. Thank you.
Great. Thanks, Amy. And I should also say that whilst many of us are in offices or maybe even at homes, Amy is actually joining us from Edinburgh Zoo. So that hopefully, if we hear some noises in the background, we might have some special guests participating, who knows, as well as the chameleon over your shoulder. And Jordan.
Hi there, yeah, I'm Jordan Brewer, and I'm Policy and External Affairs Manager at Cymorth, Cymru. So we're the representative body for providers of homelessness, housing and support services in Wales. We represent around 80 organisations across Wales, and this includes third sector support providers, housing associations, as well as some local authority teams. And our main role is to kind of represent providers and the people they support to the Welsh Government.
Great, brilliant. Thank you, Jordan, and thank you everyone for joining us today. We at St Martin Fields Charity have run this year, for the 7th year running, our frontline worker survey. We had 1,000 responses from across the 4 nations. It won't surprise any of you here today to learn that the wider economic situation and matters to do with personal well-being are very challenging. 52% of frontline workers said that they're struggling to pay their bills at least some of the time. 44% have struggled to pay their housing costs at least some of the time. Close to half spending their own money on work-related costs, and under a half, so 47% of frontline workers reported feeling secure in their jobs. There are also the cumulative stressors, the impact on frontline working.
80% of the 1,050 people who we heard from said that they always, often, or sometimes feel at risk of burnout. That's a startling figure, and something that we're going to be speaking about today. And I should say also that, you know, hoping that everyone is able to speak in a candid way, and to share a content warning in case there are some troubling, sensitive and upsetting issues that we do discuss. 64% of frontline workers feel that their role has a negative impact on their well-being. We had some positive responses, though, about the number of organizations that are operating now in a trauma-informed way, and with psychologically informed environments in their workplace, as well as the service delivery. 68% of frontline workers said they have a good workplace culture. And I think that really speaks to something around supervision, line management, as well as horizontally peer support. I'm going to start off, like I said, with some direct questions to each of the four panelists, and then we'll move on to more of a general discussion. Kellie, if I can ask of you first, what can commissioners and funders do to ensure that staff and worker well-being is built into contracts and delivery expectations, to unburden frontline workers and their organizations of their extra challenges in delivering the work that they do in a very difficult environment?
Thanks, James. All I can say is thank you to all the frontline workers. Let's start with that, for the work that you do. What we find in Northern Ireland, I'm a politician, so I'm one of the decision makers. I recently at a committee meeting asked the civil servants who talked about their wellbeing provision for their staff within the civil service, and I asked, was that same wellbeing extended to frontline workers, particularly in the homelessness, or who are working with homeless people? And they said no, it hadn't even entered their minds. So I have to say that those who draw up contracts, unless they are told what to include, they won't include it. Now, Northern Ireland is having a horrific situation at the moment with our budgets. Money is very tight, but that shouldn't be at the detriment of people's well-being and mental health. So when I asked that question, then I've been following up with why don't we have that inclusion? Why, when someone makes an application for funding, whether it's a grant or a contract, can they not add into the training? Or can we not actually add in, when the contract is being awarded, that there are points for looking after people's well-being? Because as a commissioner of services, when I look at this, I look at the situation and I say, okay, right, we need frontline support for people who are homeless to try to move people from being homeless into housing. But the frontline people, if they're not there, who else is going to look after that? Well, then that will be our accident and emergency departments, it will be the police service. So in not doing this, it's going to cost more money. So how do we actually provide this? Now, we use the supporting people model in Northern Ireland, which hasn't been really increased in volume or in money amounts for over 10 years. It's just terrible. So it means then for every organisation that is applying, the amount of money has not really gone up. So whatever more they pay for through their contract is actually reducing their ability to do services, because the more that goes into pay and terms and conditions, which is something we desperately need to improve, the less services can be provided. And that puts pressure on frontline workers because they don't want to do less. So I think, to be honest, I took the initiative to go and speak to frontline workers. And I found that extremely empowering, and it gave me a lot of knowledge. And I was able to go back then to the negotiating table to push then on behalf of those workers. So I think that that's a key part of this. Don't feel that you're very far away from that commissioning table. Politicians are available and can be used to ensure that your message is put forward. But the commissioning structures need to change. I think we need to be very realistic that when contracts are being decided, that mental health and well-being is as important as on-the-job training. And we need to consider that going forward.
Kellie, thank you so much. We were hearing this morning, Jordan, about the successful campaign with a huge amount of effort and collective work to secure a base pay increase for frontline workers in Wales. Now, we know that poverty, and this is a definition from Helen Barnard from the Trussell Trust in her book about the Beveridge report, said poverty is about falling so far behind that you're shut out of ordinary life. So in Wales, secured this 7.8% increase in pay for staff, but beyond pay, what is it that you've seen and heard from frontline workers in Wales that can improve well-being? And that's about issues about how physical and mental health are impacted at work, but also about well-being, something about the ability to navigate, manage through and withstand change.
So yes, like you said, that we have had that 7.8% increase, which Katie kind of gave an overview of this morning, and we are really pleased to see that. And I think what that kind of speaks to is the relationship in which we're able to communicate the kind of needs and wants of frontline workers through their own words. So as I said earlier, we're the representative body for Housing and Homelessness Association, but we also run the facilitate the Frontline network in Wales, which enables us to bring together a large group of people to kind of hear directly from them how things are working. And I would agree that things have kind of become very compounded for people at the moment. We did a series of reports during towards the end of the main lockdowns in Wales, which spoke to frontline workers about how they were kind of feeling, and it really did highlight that how close to homelessness themselves people who working in frontline roles really were, and how unacceptable this is because of the absolutely skilled, compassionate, amazing work that everybody's doing, and how that should be recognized. So we are really glad to see that kind of commitment to pay that was raised in the First Minister's manifesto was is on its way to becoming more honoured now through this initial point at the 7.8%. But in terms of kind of a wider what can be done, I think actively showing that frontline workers are valued for the work that they do throughout a continuation of this collective action. So thinking about how we can really, as whole sectors, come together and kind of share that data and that impact, and really let decision makers and the wider general public know what an amazing impact that people in these roles are having, because that is something I think is the disconnect. People kind of know what a social worker does or what an NHS nurse does, but there's this kind of not as much of a known entity of how much people working in homelessness services do. So I think being able to bring together that data and kind of really show the impact of this work will be able to kind of be seen in the same context as some of those other workers then, and get that parity and that resource for people to feel valued in their job that they need.
Jordan, thank you. And that parity of esteem in what work people have been delivering, but also the challenges they've been under, thinking around, through the worst stages of the pandemic and the cost of living and cost of essentials crisis, how that has hit so many people with, as I was sharing, 80 odd % of the respondents to the survey have said that increase in demand for homelessness services has gone up in the last 12 months. We've also had, in those responses, 16% of frontline workers who answered our survey said that they have lived experience of homelessness themselves,
but also almost a quarter said that they are worried about becoming homeless sometimes themselves at the moment, given the pressures that they're under. Pam, I wanted to ask, what do you think the kind of social contract beyond, just the kind of the legal contract between employer and employee is for frontline workers to ensure that their well-being isn't negatively affected because of their work and working in that given organization? And do you think that there's a connection then also between staff well-being and staff engagement or participation?
Thank you for asking me that question. I thought you might do. And also, just for people's information, I've noticed that one of my staff members is on this. So she might be sitting there going, lies, lies. We don't do that. But Marina, hello, and do chip in with whatever you think. I suppose the first thing I would say is I wouldn't describe it as a social contract. I'd describe it as a psychological contract. So I think that, if you look at, you've got the terms and conditions of employment and your contract and your job description, all that kind of stuff. There are very rarely problems between an employer and an employee in relation to contract. But the psychological contract is where you get into all sorts of fruity business, because people have expectations of each other that they don't necessarily set out very well in a kind of legal employment kind of a way. And that's where you get problems. So how do you avoid that? I think that's really interesting, because I think there are two things that organisations can do to sort of mitigate some of the risks around a breakdown in either type of contract. And the first one is about planning, and Amy will probably have a chuckle about this with me. So planning, being really clear about what the expectations are of people, what they're going to be delivering, when, why, having some purchase around what's in those plans, having some control over it. And that requires coordination, clarity of thinking, head scratching around stuff like how we're going to monitor and evaluate things, all that kind of thing. And if organisations are delivering to contracts, often quite a lot of the parameters for those plans have already been set out through the commissioning, which in some respects makes it a lot easier. But in other respects, then potentially creates a kind of sort of rod for your own back. So that's sort of quite interesting. And I think some of the issues that we've had at the connection have been because lots of our services weren't commissioned. And as a result of that, we were just sort of doing what we liked, really. And it didn't quite get into being like Lord of the Flies, but that's the risk. So really good, clear plans and ways of monitoring whether or not you're achieving them. Brilliant, because then everyone knows, even if it's hard, everyone knows whether or not they're actually doing the stuff that they're meant to be doing. And then the second thing is really about how you work, which then draws on sort of questions about organisational culture. And at the connection, we've done quite a lot of work, which is still ongoing, about how we work together. So we've got a working together policy, which goes way beyond a sort of code of conduct or, how we behave in the office. And it's about the traits and behaviours that we expect to see in the staff team. And they relate to everybody. And there's like a little sort of heading for them. And then there's a sort of framework of things we expect people to do. It is not a competencies framework. It's an expectations framework. Mm-hmm. And then we have something for managers to set out what we expect from managers. Now, because we've done that, it's much easier to describe how we want people to hang out with each other. And I don't ever expect an organisation to have no arguments or conflicts, but disagreeing agreeably and having open lines of communication across hierarchies is incredibly important, and having that kind of mutual respect.
Thanks so much. I think that's really important distinctions there, and
about the obligations that we have for one another, as well as the duty of, the mutual support, as well as the duty of care in terms of the kind of vertical hierarchy within an organization. Amy, and reflecting on Pam, you've said that you and Amy have previously worked together. We have in the Q&A that someone has said, Anne-Marie, that Pam and Amy were first managers when was working in the community with homelessness in Scotland. I'm thinking, Amy, about the particular depth of insight you have from your longevity of service, about the differences and improvement that you've seen during that time, as well as, I guess, a question about, has progress been linear in working out how to better or best support individuals and teams with their well-being, or given external pressures, have things sometimes gone backwards? So what do you think that you've been able to achieve in supporting colleagues, as well as direct reports, with well-being, and what are you most proud of with that as well?
Yes, absolutely. Lots, and not in a linear way would be the first part of my answer. I guess one of the things that we've been working on, and I guess for many years, is almost like a reimagining of what a working week should be like for somebody who works in frontline role. And I think historically, many of us, including myself, have been really guilty of looking at contracts and tenders from a perspective of what's the demand and what's the money, and how do we meet the demand with the money. And then anything that's left over at the end of that gets slotted into your training budget or your expenses budget or whatever. So you're starting off with the sort of, I guess, the sort of equation, which is not based around the sort of health and well-being of your staff. And it assumes that the more that you can do and the more outcomes you can achieve, the more staff you've got. And actually what we've been trying to do is sort of pick that apart in lots of ways. Firstly, with staff themselves, what we find is we work in a sector where staff get into this work because they have a real desire to help. And we're also working in a sector which has been grossly under-resourced for as long as I've ever worked in it. The result of that is you've got these really, really hardworking staff who try and bridge that gap. So what you find is that staff create this culture where they're always working, they're always front-facing. They're basically doing relationship-based work, which requires them to be in a relationship and with people all of the time. And while that is really, really admirable, absolutely, of course, it's going to take its toll on people. So we've had a bit of that cultural stuff to work through with staff themselves, when actually it is okay not to be dealing with a crisis all the time. It is okay to be at training. It's okay to have your days off. It's okay not to be on call this weekend if you're not feeling able to do it. Those kind of things. The second thing we've been doing is some quite really practical things around, this may sound ridiculous to some people, but budgeting exercises. And I'd sort of just described to you there how we usually go about filling in a budget. How much money have we got, what have we got to do, how many staff we need to do it. And actually just starting to change some of that so that even the order in which we do that looks quite different. So we're starting with actually what will staff need in order to do that job well, not how many staff do we need to do that job well. And little things like that do take a bit of time. We're aware, though, that we're kind of fighting against a fairly strong, I guess, a kind of force in terms of lack of resource. We're in really, really tough times. It's quite difficult for us to force our way of working onto the local authorities that contract with us, who have very little money and less every day to do it. However, we don't think we can. We think it's really important to stick our ground with this, because I think not only have we got a sort of sector that's under-resourced, we've got a sector where we've come to value some things more than others. And the frontline work that we do tends to be the work that attracts less value from a financial perspective. And I think that's a big job to turn around. It's certainly a big job for one single organisation to do, but I think there's something sector-wide we need to do to make that sort of slight shift. So just to sort of summarise, that reimagining of the working week from a sort of cultural perspective, from a sort of paper and systems perspective, but also looking at what are the types of things that make you able to be your best self at work, bring your best self to work and deliver the best intervention or relationship you can with people. And that is as much about being available as it is being informed, being trained, being relaxed, being supported. So we build in a lot around things that like practice, communities of practice where staff with particular interests can come together. We obviously our support sessions with our staff and their line managers, and we're a learning organisation and really prioritise training, including something very similar to what Pam described there, which is Cyrenians' way of working, Kawau, snappy title, which sets out again not just the sort of theories of practice that we work within, but how we'll work with each other.
Amy, thank you so much for that, for your thoughts, and it's really important to recognise and to celebrate the successes as well. And I think that, you know, we can get caught up with some of the very big ambitions and long-term plans. It's actually, there's, you know, it's possible to make really tangible difference, improvements, and, you know, to people's day-to-day lives with small interventions as well as the bigger ones. On the responses to our frontline worker survey, we had a really interesting bit of analysis that came out of it, was that feeling that their work was making a difference did not make people any more likely to expect to stay in their role. So we've got a huge amount of dedication, you know, a really surprising number of people who have been in their role and frontline workers across different organizations for 10 plus years. But we know that there have been particularly strong challenges, you know, definitely during that decade and beyond, and especially thinking around the closure of organizations, the increased demand for services, and the money available, as everyone has noted, to actually deliver work. Something that really raises for me is about people's sense of control or power. You know, we talk about the feelings of not having any options as losing control, about that being disempowering, and about the possibility of losing hope there. I'm wondering around in the different regions and indeed in the different sectors, what is it that galvanizes your staff, your peers, your allies, do you think, to most effectively give people a sense of hope? Is it even possible to give people a sense of hope, or does it need to be they develop that themselves? This is open to anyone here to answer.
I'm happy to jump in, and I'm sure the other panel members have similar reflections as well. But I would say, going back to that, making people feel like they have autonomy day to day in their workplace. So that kind of listening to each other that Pam and Amy had been talking about, the relationships between staff. I think it was just really powerful seeing this morning when you did the word cloud, asking people what helped to get them through a rough day, and a lot of the things that people said was their team members. And I do think that creating a culture where there's relationships where people are actively checking in on their team members when they know that they've had a rough day, and knowing that they can kind of expect that support from their team members as well, goes a long way to making it kind of bearable day to day in work. Because what we've spoken to quite a few frontline workers across Wales recently, around 80 to 100 on the new mental health strategy that's coming in Wales, and a lot of the things that have been coming out of that is people saying that they feel like their job is to help, and because of all of the barriers and the way they physically can't do that and how demoralizing that is. So I think really having that sense of community, and some of the other feedback that we've got is that hearing from other people working in similar roles and similar organizations, knowing that it's not kind of just you, it's the system that we're up against. And then, yeah, that, as you say, celebrating those individual achievements as they come, and then working with that collective action towards a larger systemic change.
Thanks, Jordan. And really kind of touching on what the contributions were in that word cloud. Everything from better mental health support, managers trained in mental health, effective management, supervision, counselling. I mean, it's from how people work as well as the context within which they're working. Pam, you wanted to come in on that question.
Yeah, I've got so many things to say. I'm just like trying to boil them down to a sort of reasonable thing. So I think the first thing I would say, just echoing what Jordan has said, in organisations, I mean, I would love to overthrow the government, massively change all the social welfare provision and build a load of houses. However, I'm not going to be able to do that for a whole load of reasons. So what I'm going to do is focus on the stuff that I can control. And I really invite people to think about their situations in those terms. There is there's a climate emergency, loads and loads of migration that's really affecting homelessness in a way that I don't feel I could control. So all of that, AI, right-wing populism, there's lots of really horrible things going on in the world which I don't like and make me very sad. But when I come into work in the morning, what I want to do is feel like I'm making a difference in a area where I have some influence and control. So I really invite people to think about what they can control and what they can influence when they're at work. And if you work somewhere that's quite sensible, and I think most organisations are pretty sensible, you ought to be able to have some purchase over what the organisation does. This is like my plea, because I've got this amazing audience of frontline workers. My plea to you is, please try not to other your senior managers. There's a few wrong uns out there, I know, who can be very frustrating, and it can feel very, very disempowering. But there's also some great people in positions of responsibility. Be curious with them. If they're doing things that you don't understand or you find quite annoying, most decent, reasonable people will really appreciate the conversation. And it doesn't have to be like Jeremy Paxman. You can just sort of, exercise your curiosity and you will get the same in return. And then my plea for managers is to try to steer away from language like supervision, because it's very parental. One-to-ones would indicate an adult to adult working relationship. And that's the kind of stuff that encourages people to see each other as cogs in the same machine, rather than there being a hierarchy that means that you're losing control over what's happening. So which then means that I think all line managers, it's the law, should be doing coaching skills to supplement their line management responsibilities, so that they're not just telling people what to do all the time and being really directive, because it's really annoying.
Thank you for your candor as well. Of course, on the point about wanting to overthrow the government, reminding everyone about there is an opportunity for many people to vote as their conscience dictates. And I've been really impressed by the work that's been done to remove the barriers and encourage those people experiencing homelessness to register to vote. And I think, we've had a lot of general elections recently, and that's a great thing for you, Pam. As you said, you get really fired up on those, but knowing that we may not have one for a while after this one. Of course, that ability to look at the manifestos and understand what each of the main parties is offering. And I think that this is as much about housing as it is about the NHS as well, looking around the demand for mental health services and about staff retention and recruitment in primary healthcare, and offering the support that not only those people seeking support from homelessness services, but also about staff, colleagues, and all of us and our families as well. Amy, I wanted to bring you in, and if I could, I just wanted to introduce one thing which I think we started to touch on, and Pam, it's interesting what you said about not othering managers. Of course, there were anecdotes in the Frontline Worker Survey of bad experiences, and people really trusted us to share those anonymously. Experiences of a split hierarchically within an organization. What I also wanted to cover, and Amy, if there's a way to respond to this in addition to what you were going to share, is around issues of discrimination, harassment, and the extra challenges to well-being for marginalized, minoritized, racialized frontline workers, as well thinking around different protected characteristics for disabled members of the frontline workforce and others. So what are some examples that you've seen of ways to better support and mitigate that differential negative impact on certain groups as well? So for Amy, and then I'd love it if the other panelists can also speak to those issues around diversity as well.
Yeah, thank you. I guess that the kind of one of the first most important things within our organisation, we have an inclusion and diversity group, which is entirely made up of staff who have volunteered themselves, some of them for many years. It's a regularly meeting group who take responsible for raising some of the issues across the organisation that our staff and our service users as well experience in terms of how they both give and receive support, and how as people who use our services and people who work with us. And from that, we've been able to create an incredibly helpful work plan, which is entirely driven by the staff in our organisation, primarily the ones who are frontline workers. We haven't said specifically we don't want managers or their senior team within that process, but it is primarily frontline workers. And I think that links back to the conversation we had earlier on about ways in which people can feel valued, which aren't always about whether they're financially valued or not. Being valued because you have an opinion and experience that matters as much as anybody else's, in some cases more than anybody else's, because it's your experience and other people don't share it. I think that can be incredibly empowering for people. I think that can make their experience of the workplace far more positive than it would be, despite some of the challenges around, as we've talked about, sort of recognition and sort of pay and reward within the sector, and some of the other issues we're sort of touching on here in terms of job satisfaction when you're working in a tough climate. So yeah, as I say, I think having staff lead that inclusion and diversity work within the organisation, and it to be a very central part of our work plan, has been quite revolutionising for the work that we do. I think certainly I am seeing some of the work that I do, particularly through sort of the kind of policy development and decisions, I'm able to look at those through a slightly different lens to perhaps I would have done previously.
You, Amy. Are there any other contributions on that issue of equity, diversity, and the differential impact when it comes to discrimination or access to mental health support and well-being? Pam?
Yeah, I mean, I think this is a really interesting and important issue. It's something that we've been taking the lid off at the Connection for a while now, and And a lot of the sort of things that you would expect an organisation to do, we've done. The biggest issue that we've had that we haven't done yet, but we've started addressing, is the extent to which clients are behaving in a way which is discriminatory towards other clients and staff members. And we can't just exclude people because they've discriminated against someone else, because the kind of people that we're working with, I mean, we might end up not having very many clients if we did that, to be honest. And a really big part of our role is to work with people who are incredibly vulnerable and not always very nice and not always very rational in the way that they're behaving. And it is our responsibility to hold that as an organisation. We also have a responsibility under the Equalities Act to be providing a service to people who exhibit protected characteristics, as well as potentially discriminating against somebody. So we've got to balance that with the rights of staff under the Equalities Act. So we've done some internal training with everybody that was compulsory, about understanding more about how clients communicate and why. And do you know, one of the biggest revelations of that I really enjoyed was pointing out to us that very few of the clients have done the EDI e-learning module, and therefore are highly unlikely to know a lot of the language and the expectations of our staff team about how they behave towards them and to each other. Some of them know fine well that they're being provocative sometimes, but on the whole, there is not a shared understanding. So that for me was a bit of an aha moment. Oh yeah, that's really obvious now you've pointed that out. Number two is that lots of our clients have got language difficulties. There's lots of neurodiversity. People are coming from cultural backgrounds where there's quite different expectations. People are speaking English as a second language. And so there is a learning and education point for the connection in providing people with some parameters and an understanding of what is a more acceptable and appropriate way to communicate with each other and with staff members. And then the third thing is the role of other staff when they see one of their colleagues being discriminated against. So the role of all of the staff team as active bystanders, and knowing and having the confidence to intervene, so that again it becomes a sort of habitual cultural thing of saying it's not okay for you to say things like that, but knowing how to say it in such a way that it doesn't create some massive hoo-ha, and it is a point of learning and development for a client, rather than it being an accusation and a reason to exclude somebody. And all of that is quite complicated to navigate. And I'd love to tell you that we've done this, that and the other, and I can circulate a policy. We're in the middle of writing that down, and we will be doing, having done compulsory training with people on communication, we're going to be doing compulsory training on active bystander, on the role of the active bystander once we've completed our policy work.
Pam, thank you for that. And you raise a really important issue around the bilateral relationship between frontline worker and a person seeking support, but also about bilaterally between people accessing support services at the same time, and about diversity within those groups as well. And certainly when you introduce, as you mentioned, with language issues, about an interpreter perhaps in a triadic setting, another possibly complicating factor there. Kellie, I wanted to bring you in. I'm aware that prior to becoming a member of the Assembly, you had a very committed background in the healthcare and disability rights. There's also about you're a staunch advocate for integrated services in Northern Ireland. I wanted to know if you could speak to some of the sensitivities and challenges in navigating that and thinking around the delivery of services across communities in an inclusive way.
Sorry, just had a problem unmuting. Yes, in Northern Ireland, as you can imagine, we've had quite a divisive society for a long time, but it has gradually improved over the years. We have a policy in Northern Ireland called Section 75. Section 75 requires government to consider marginalised or minority people based on gender, sexuality, age, religion, whether you have a dependent or not, your disabilities. So all contracts have to, well, are supposed to ensure that there is no discrimination on any of those people. However, in practice, it tends to be a bit of a tick box. To say that you're not discriminating against someone is not good enough. To say that you're proactively including someone is different. It's very different. So if you want to ensure, for instance, that if you talk about the newcomer population, I was just actually jotting down a note because an idea sprang to my head. We have it currently, or in Northern Ireland, we have it currently that there's training available in our health service, for instance, for frontline staff in hospitals, GP surgeries, to have some training on newcomers. Why is that not extended out then to the frontline network, to anyone who's working with homelessness or housing, the benefits offices, all of that? So is that something actually that can be led by the network as a lobbying policy to say that there needs to be a recognition of the fact that we are the people on the front line? We are the people who have those first and very important communications with people, whatever their background is. Doesn't matter whether they're disabled or if it's language barriers. But the fact is that everybody needs to have that training, that support, that understanding, so they know what the lines are and when someone has crossed them and what to do about that, or what is that line, what is acceptable and what's not acceptable, what's safe and what's not safe. And I think that would be a wonderful opportunity, because when I look at the fabulous work that has been done by the guy Jordan and the guys in Wales on pay, can you imagine if the network all came together and said, actually, this is something that we uniquely have, but we also share this with, health, perhaps some education, police. So is this something that we could ask for all frontline workers, that there's this support? Because we do have a growing, diverse group of people coming through who are homeless. And so not one standard way that you can approach someone with their homelessness works. So you have to take a different approach depending on who that is. For instance, if you're in Northern Ireland today and you were looking for a wheelchair accessible bungalow, you will have 5 years to wait on that for a house. It's just despicable. Depending on which part of Northern Ireland it is, it could be 10 years. So there's a frustration there, because the frontline worker who's trying their very best to create the solution for the person, the solution isn't there. So how do you help them? And then if there is a bit of abuse, that could be coming from the housing people, or it could be coming from the person themselves. It's about supporting the frontline network, the frontline people who have a tough enough job, but are almost stuck in the middle, dealing with clients, with people who need help, and dealing with the barriers that other statutory agencies and others are placing in their way. So I think that idea that the network could come together as a lobbying campaign to say, actually, guys, if you don't help us to do this, things will get worse. If you do help us to do this, then we can at least limit or reduce the amount of problems that there can be. Can you imagine if you're a mum and you've got 5 kids and you've just come to live in an area and the language barrier is a problem, you're having to depend on one of your children to translate for you, and here's a frontline worker talking to you about what your needs are and where you could possibly go to live. For the frontline worker, the frustration will be taken out on them rather than, all of the whole system that's falling down for that person. So no, I think that there's something there about asking government if they're doing it within their own statutory provision, why can't they do that for the frontline services that they're funding?
Yeah, you make a very compelling case there, and I think it's something that when the rationale and the why has been so clearly articulated, it leaves in my mind, when this session finishes, is thinking how to make that happen. But the case is very clear.
I think one of the things that I always say to people is, you ask the question of government, do you welcome newcomers? Do you welcome people with disabilities? Do you welcome people of age, people with dependents? Well, then why are you not helping us to support them?
Yeah.
And I think it just puts it straight back. Your commitment is, and you can look at manifestos if you wish to, your commitment is, for a diverse society. Well, this is how you work with a diverse society. We need you to, catch up with the rest of us.
Yeah. Thank you. And what's been on my mind as someone who's disabled and also has caring responsibilities for two small kids, is around the extra, financial pressures that certain people have, and about the absence of support, financial and otherwise, that many people find themselves in. That can be exacerbated by poor legislation. It can be exacerbated by poor policy. It's also about the relationship between welfare and well-being, I think, is something that comes up there. An area that's been increasingly covered, and I think that is a really welcome addition, not just to the discourse, but about how funding has been transformed, and there's still a long way to go, is around funding for prevention. And that's as much in public health as it is in other areas of policy and practice. So, there's a really good paper that came out from the Future Governance Forum and Mariana Mazzucato a couple of weeks ago around a possible Labour government mission-led approach, having cross-government initiatives. And indeed, at the NCVO hustings yesterday, the Labour panelists said it's not just about cross-government, but it's about partnerships between government and civil society. So thinking around prevention, what else can the sector be doing? I think practicing what we preach and the kind of services that you would want, and the standard of care for people experiencing homelessness who come for support, and then for staff as well. How can we, there's a question in the Q&A, is burnout inevitable? So what can we do to prevent burnout? What can we do to prevent nosedives in well-being when the external context that many people find themselves in at home, and clearly with the demand for services at work? What can we do within society in making better policy and in funding as well? Jordan.
Hi, thanks. Yeah, I think burnout that people are experiencing, particularly in homelessness services, and particularly people working on the front line in homelessness services, is down to it is kind of like the last line of defense. People have gone through all of these other public services who, for one reason or another, because there's resource pressures in all parts of the system, have been let down. And now people working in frontline services have to kind of have all of these different skills around mental health, substance use, and caseloads that are extremely high, and of course that's going to lead to burnout. One thing that is fairly exciting that we have on the horizon in Wales is some legislative proposals for new legal duties on wider public sector organisations, so they'd have a duty to identify where somebody would be at risk of homelessness, act where it's within their capacity to try and prevent that homelessness, and then refer when someone is experiencing or at risk of homelessness. And what that's doing is it's kind of not be duplicating work, and also not letting people slip through the gaps as much, and also not letting it where people are getting to such a crisis point. So that kind of sharing out of responsibility and duty, where everybody is kind of acting at the right time in a preventative way, would, we feel, be really transformative. And it's something that we, as Katie, who our director was a member of the expert review panel who made recommendations on this legislation, something that we're really, really big advocates for. The white paper has cross cabinet sign off, and we've had the consultation, and now this is being considered by officials, ministers and lawyers, and we're really, really pleased to say that frontline workers in Wales directly influenced a lot of the outcomes of this white paper, especially across the year where the expert review panel were meeting to make the recommendations. The Cymorth, as they were facilitating the Frontline network, were actively having an open dialogue with, well, this is kind of what's being discussed in the panel meetings, this is what's coming up, do you think that there's anything missing? And we really, really heartened to see that the panel members really kind of took that expertise and insight from frontline workers very seriously, and it shaped an awful lot of the recommendations. So yeah, that's something where we think would be a real game changer in terms of burnout and the pressure being specifically put onto frontline workers.
Jordan, thank you for that. And what's on my mind is some of the Welsh contribution to all of our well-being in looking at what Bevan did in being the kind of midwife for the NHS in helping to set it up, but that he was concurrently, as well as the responsible for the health service, was also in charge of housing, and it really speaks to that that intertwined dimension. And yes, there are kind of specifics to the the political landscape at the time, but I think that that's something really really notable there. Amy.
I was just going to add in just to what Jordan was saying. Similarly, we've obviously got a housing bill going through the Scottish Parliament at the moment. We co-chaired the Task Force Group on Prevention alongside Crisis, and a main component of that is Ask and Act, very, very similar to how Jordan was describing. And I guess at the same time, we're very lucky in Scotland. We've got a very engaged and very accessible set of elected members. We're able to meet with very regularly. They meet with us as staff. They meet with people who use our services. And we've got a great ministerial oversight group who all basically the different briefs come together with the housing minister to look at homelessness, which we know carries the can for the systemic failure in lots of other places. The problem is that there's a real danger that the whole thing is going to be it's undermined almost by the fact that we're in a housing emergency at the moment. And you can see straight away that the commitment to prevention and early intervention and taking a public health approach is going to be very, very difficult to keep front and centre when we're dealing with the crisis we are around lack of housing. So we've got a real concern that the resource in the prevention area is not going to materialise. And at the same time, we use this analogy all the time, the bath is going to keep overflowing because we cannot turn the taps off. So there's a real pressure there. There's a couple of things I want to just very briefly mention, because I know we're going to finish in just in terms of policy. One of the great policy initiatives that we have benefited from as an organisation has been the work through the Promise, which is Scotland's commitment to care experienced young people. We've been able to draw down significant resource from that to take a whole organisational approach to being psychologically informed, so it recognises, yes, we're working with lots of young people on the edge of the care system, but we're working with a population of adult people who are homeless, many of whom were care experienced when they're younger. So that's been a really great bit of policy initiative, which we think has hit beyond its sort of immediate target area. And the last thing I was going to just say, and it's not the answer to everything, but going back to some of the earlier conversation we had about staff, feeling the extra pressure of the demand on frontline staff, not just because of the volume of people who need help, because the limits of what we can do. We find staff saying, I'm really, they talk about being really, really stressed and concerned that they've not been able to get somebody an appointment with a counsellor, or very, very stressed and concerned that they're working in housing first, but they've not been able to get the person a tenancy. And these things, like you say, they can really undermine how people are feeling about their job. One of the most helpful things that I have heard said to those staff, it wasn't me who said it, it was the psychologist does a reflective practice. And I think it really, really hit home with people. He said, you're waiting for magic bullets here that you can't control. And you need to realise the intervention is not the counsellor or the house. The intervention is the relationship that you're having with the person now, and whether they were actually achieving something or not, because they absolutely were. It just wasn't that coming up with a house, etc.
Amy, thank you so much for that. It's clearly, with a minute barely to go, I want to say, firstly, thank you, but there's also a big difference between, I read a book by Fran Darlington-Pollock, one of our allies, of course, in homelessness across Greater Manchester, and a book by her talking around disease and public health, and about, the real aspiration is human flourishing. We're a long way off that, when what we've got is the reality of such significant risks of burnout, and to use Hilary Cottam, social designer's language, about people being just tired all the time and having medically unexplained symptoms because of the pressures of life and work. We know that things can be better. We all want things to be better, and I think that there's some fantastic ideas that's been shared on how, and how especially for certain groups. We are at time, unfortunately, for this conversation. I really wanted to thank all of the panel for the contributions. This is something that we can do very well to take stock, to validate the experiences of frontline workers and their well-being. It's a very difficult subject, and I think that in the tactical as well as the the strategic things that have been mentioned, taken together, all of those could be sustainable solutions. Clearly, there's something around the mindset and the funding that needs to go along with it. But I'm left in a in a very hopeful mindset that through each of our interactions day to day with colleagues and through what we can control, that a difference can be made today, a difference can be made tomorrow, and we can help ourselves and help colleagues to get to the right place. Kellie, Jordan, Pam, Amy, thank you so much for that. Really appreciate your contributions, and say goodbye for now and on to this afternoon's sessions. Thank you, everybody.
Thank you.
Bye-bye.
Thank